What is Invisalign? Invisalign is orthodontics. In other words, it's a procedure to move teeth, and what it is, rather than using the brackets and the bands that we used years ago with the wires that moved teeth, it's now done through technology using a resin aligner, a resin clear aligner that will move the teeth. It accomplishes the same thing. Oftentimes people don't think of it in terms of being orthodontics. Invisalign is orthodontics. What are the health benefits of Invisalign? Periodontal health is a health benefit, and often teeth that are misaligned, or I'll just say they're kind of jumbled up, they're not straight, those are hard to keep clean. Those are hard for patients often to keep clean. And then what happens is there will be some, it's a lot of times referred to as gingivitis. You'll see that on TV. But that's bleeding gums. Well, our goal is no bleeding. In terms of gingival health, which is a health issue, gingival health, periodontal health are the same. When there's bleeding, that's an inflammation. And inflammation is a real thing, and there's a health effect because of that. Well, teeth that are aligned, teeth that are straight, are easier to keep clean. We talk about periodontal health, but decay is also a disease. And it's a disease of hard tissue, a disease of teeth. And actually, it's a common disease because there's a lot of people that have decay. And teeth, as I said earlier, that are aligned are just a lot easier to keep clean. What are the advantages of doing Invisalign? Well, number one, the advantage is that a lot of people, especially adults, you can do Invisalign and other people do not know that because we don't have the brackets, we don't have the wires. And then also, and excuse me here, thank you. Also, when at the beginning of treatment, we can have a pretty good idea how long treatment is going to take. So that the patient knows that in the beginning. Now, and also we explain to patients about the necessity to wear the aligners and the regimen and the number of hours to wear them. They're a lot easier to keep clean. And here, I've seen this many, many times where we used to use the wires, the wire that went from tooth to tooth to tooth, from bracket to bracket to bracket. Patients would get decay or decalcification, that's the beginning of decay, around the edges of the brackets, which a lot of times didn't show up until we were done. Well, with Invisalign, it's a lot easier to keep the teeth clean. All right, also, because the wire affects how food impacts the gums, that's also an issue. And it doesn't happen with Invisalign. It's a lot easier to keep the gum tissue healthy also. All right, at the same time, those are a lot of the benefits of Invisalign. What are the disadvantages of Invisalign? Wearing them, compliance. When we would put brackets and wires on a patient, we were in control. We'd send them home and it would hurt because there was no way to avoid that. But when the aligners hurt, patients sometimes will take them out. And when it's not being worn, then it's not being effective. So that's the one thing that I see as the disadvantage, is patient compliance, especially teenagers. When the mom wants the young person to wear them, you better talk with the patient, because if the patient's not going to wear them, it's not going to work. Okay, so clear that up with mom and the patient. Now, how long does an Invisalign treatment typically take? Depends how many of the aligners there are. It's 2 weeks per aligner. Now, recently there are some things that we can do that help speed that up, but typically it's 2 weeks per aligner. And so if there's 10 aligners, that's 20 weeks. 20 divided by 4 is 5 months. That's another advantage of Invisalign. A lot of times it goes faster because the pressure is constant. It's not you come in, we get the wire, adjusted, and then the pressure is on there. The pressure is constant, and you can change them at home to the new aligners. So again, we get to be applying the constant pressure, which typically then makes the treatment go faster. How often does one have to visit their Invisalign dentist? Well, normally what we say is 2 weeks. It's 2 weeks per set of aligners, and it's that I think that will remain the standard for a time. But as I said, there are some things that are being developed that can help speed that process up, where treatments that would, as I said earlier, if they were going to take 10 aligners, that would be 20 weeks. If they were going to be 30 aligners, then that would be 60 weeks, excuse me. 30 aligners would be 60 weeks. And typically that's how long those take. And if it improves, we'll be there to find it out. We'll be there to share it with you. And if there's any other questions that you have about Invisalign, you can let us know. Thank you very much.